So the first question that I think it's very important, is most doctors might be testing for biomarkers in adenocarcinoma, but not squamous. Why is that? And is this changing? And how do you approach patient with squamous cell carcinoma when deciding on doing or not doing molecular testing?
Yeah, so as far as the molecular, the targetable molecular alterations go, they do more commonly occur in the patients with adenocarcinoma. But as far as my practice goes, even those patients with squamous cell carcinomas, there's still a very, while the fraction of patients with targetable alterations are much smaller, I would still do molecular testing in all patients who have non-small cell lung cancer.
Yeah, I mean, I agree. I think especially in squamous, if we don't look, we can identify a target. So, and those patients with squamous also it could arguably have, especially a BRAF or a MET exon 14 skipping. Those are known to be in smokers and in squamous histology, among others, while less common compared to adenocarcinoma. So I think removing that bias is also very important. Removing the bias about a smoking history, because I've certainly been surprised myself when I'm meeting a patient, getting a history, and while that can help, a little bit in predicting whether or not I suspect someone to have a target, I've been very surprised to find an EGFR in a patient I didn't expect. So.
Mhm. I agree. And I think especially like if any of you on the call have squamous cell carcinoma and you have a minimal history of smoking, there is a pretty reasonable chance that you might be having an ALK fusion or EGFR mutation. By the way, the first ever patient with ALK fusion that was described by Dr. Soda was actually a squamous cell carcinoma patient. So I agree with everybody. And another thing we haven't touched upon, but I think it's important. Yes, we might not be having a lot of approved drugs for molecular alterations in squamous cell carcinoma, but it also opens an opportunity for a clinical trial, right? So if you find a mutation that might not have an alteration, but there is a clinical trial available for that mutation in your immediate area, I think that would be beneficial as well.